I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We are coming to you from the American Academy of Developmental Medicine and Dentistry, an organization very near and dear to my heart. And we have a fantastic guest with us today, Dr. Alan Wong. Alan, welcome.
Thank you for having me here, Dr. Escudé. I'm so impressed with everything you've done so far and your podcasts, and I'm here to share anything you want.
Well, that's very kind. Thank you. But I'm way more impressed about what you've done, and that's what I want to hear about today. So I know that you're kind of recently coming off of the presidency, right?
Right.
From American Academy of Developmental Medicine and Dentistry. What was that experience? Well, I'll tell you what. Tell us about the organization in general, and then what was that like being president?
Well, it's been an honor and a privilege, and when I took over as a leader, it was in time of pandemic, and it was very challenging to stay focused. And the purpose for the AADMD is for advocacy, education, and access to care. And trying to hold everything together while we're all distanced from Zoom was a challenge. And we realized that we had to re-identify ourselves and sort of build our board so that it can address the needs of our population. And there's a certain urgency about it. And so we gathered many board members passionate about this. And we did a lot of things through Zoom. And we started interfacing with a lot of other like-minded organizations. I think that was really key to AADMD growing. We added self-advocates and parent advocates. And we blossomed in terms of our scope and our depth in our service. And it was really a challenge, but a huge honor to be given this responsibility. And the people that I work with, I just love them. They're like brothers and sisters in this mission to help people with IDD and disabilities. I have to agree with the whole brother and sister and family mindset, because I certainly feel that way with so many people. Being a part of this community and really working towards the same goal, which really brings people together. And you mentioned the pandemic and the presidency during that time. I can only imagine. Well, I actually have firsthand knowledge of that because you and I had a lot of interactions on Zoom, and it certainly was a challenge. But you did, I would say, quite well getting us through all of that and continuing to move the organization or move forward with what the organization's goals are. So what are some of the goals of the organization? What are we here for? Well, health equity is what you hear about, but justice and making sure that everyone gets an equal, fair share to quality health care. I'm going to go back to the pandemic one more time.
Yeah.
It was a call to act because at that time there was a crisis that our population was not looked at and they were ignored, and there were a lot of injustices in terms of hospitalizations and ventilators and whatnot, that the AADMD got together with all the other like-minded organizations to create a white paper.
Mm-hmm. I remember
that, right?
Yep.
Through that white paper, it actually saved my life. I contracted COVID very badly at the beginning parts when there was no therapeutics. And in doing all the research, I remember something about ventilators being bad to go on for early. And when I was hospitalized in ICU for 4 weeks, I almost went on the ventilator 3 times. And during that time in ICU, I kept thinking to myself, how can my friends with IDD and disabilities handle this, being isolated, being poked and prodded almost every hour, and they were dying at a larger rate and quicker rate than neurotypical populations, and so it almost highlighted and emphasized the injustice. Having almost lost my life, I realized this is something we can't wait and just have committee meetings on. So that sense of urgency really propelled me to really want to make sure our last conference included other healthcare professions, and we had our first fireside chat. with the president of the American
Love
Medical.
that. Yeah. So let's talk about that. That was quite impressive at last year's conference. So who did you bring together?
So I realized that we ourselves in a small group couldn't do this alone. We really needed the speakers from the American Medical Associations. We brought President Gerald Harmon at the time, and also the president of the American Dental Association, Dr. Cesar Sabates. And we had other leaders and and presidents of other organizations there as well. But we had an honest fireside chat hosted by Neil Romano, who is on the National Council on Disability. And in that dialogue, in that conversation, that fireside chat, they looked at each other and said, we really need to do better at the healthcare system. And from that, we fostered the President's Work Group. And we've been meeting several times through the year to decide on some common ground areas, some low-hanging fruits and some high-hanging fruits of where we want to go in the direction, because we've all been doing things in our own silos. We really need to do the one voice. Instead of little small voices in each group, we really wanted to have one loud, resounding voice that we need to make certain changes and priorities. And we're going to have a fireside chat later on this week.
That's exciting. And one voice, that's kind of the conference theme, isn't it? One voice.
It's been our theme for many, many years, one voice, because it's for the people who have no voice. And so it resonates well, and I really feel like this is something that we're doing, and how can you not jump on board with this? So
do you have any particular areas of focus that this President's Committee is working on?
Right. There's just like our three pillars. In advocacy, we're working to see what we can do in terms of advocacy for the rights for our population to be able to see in regular offices instead of having to go to special institutions.
See, that's one of the things I talk about a lot, is how really the goal is that anyone with any level of disability or no disability should be able to present themselves to any clinician in really any setting and receive at least a basic level of competent and compassionate health care. That's the way I see the ultimate goal.
You're absolutely right. And advocacy, we're doing that. We're doing education. The AADMD has fostered two arms, basically, one for developmental medicine teaching. We called it back then the NCDIM project, with a national curriculum on initiative for developmental medicine.
Where it's got a new name, right?
And it's got a new name, yeah. And from that 5 or 6 year project that was hosted, and we were able to recruit 17 medical schools to incorporate developmental medicine where they never had some. That's been very successful. From that, it's spawned a new name called the NICHE Project, the National Inclusive Curriculum for Health Education.
I'm glad you knew that, because I couldn't remember the acronym for that one.
And from that, you probably know that there's been a change in the Commission on Dental Accreditation Standard, Standard 2-25, that makes every graduate from a dental school competent in taking care of people with disabilities, both not only didactic, but also clinical in a sense. And so AADMD has hosted the National Oral Health Curriculum through NICHE, so the NICHE Oral Health. That's going to be given to all the dental schools to use if they want. We've already recruited 18 schools who have expertise.
Great.
We have over 80 plus authors from all through the country, because there's no sense in recreating the wheel. We already know what it looks like and should look like, and we have best practice models. So we're gathering together, putting it in the cloud so everyone can download it and get to it. We're going to have also great works from Rick Yadadi, who's going to add some of his works to this curriculum, which if anyone knows Rick, I'm sure you've already interviewed him already.
I know Rick. He's on the list.
Okay.
So for all of you who don't know Rick is a phenomenal photographer who decided to move away from the fashion photography world and into the world of photography, helping people see people with intellectual developmental disabilities, genetic disorders in a very positive way, hence the name Positive Exposure for his organization. Phenomenal work. Look him up.
Yeah, health educator extraordinaire.
Yes.
And bringing the humanism to our population that people are, I think there's many myths that if you're taught something in a negative light, you think of them in a negative light.
That's
and
right.
if you're if you're never had the experience when you're in medical or dental training, chances are you're not going to be the first one to jump out and do it. So hopefully by improving our education in medical and dental schools, and hopefully in other healthcare schools, because we're here to share. AADMD is here to share the wealth of information to others so that other organizations, PT, OT, nurse, and anyone else, speech language pathology, would like to use the information. 60 to 70% of it is relevant. So we're here to share. And then the third part is access to care.
All right.
So the
advocacy, education, and then access to care.
So we're trying to make sure our members and future members are going to be excellent at what they do by giving them lived experiences, having these conferences where they can share with one another. And we're not in a silo of medicine itself. We're here with some nurses, we're here with some physical therapists, we're here with some social workers, and that we're not just treating teeth anymore and the mouth, we're treating the person and the whole body. And
they're kind of connected, aren't they? Just a little bit connected, yeah. And they actually really impact one another, just like our minds. You know,
Right.
Sometimes we silo mental health out of physical health. All of it is so connected and works together, and that's that whole interdisciplinary approach to health for everyone, not just for people with disabilities, is so valuable and so important.
And I think the government's seeing it. I just came from a CDC meeting of medical dental integration, and we know the disparity of care of the systemic and oral health relationship, and in our population it's even magnified. So we're in that discussion, and it's the first time that I think we have a lot more to go in terms of making sure equitable care is there in research as well. And unfortunately, data is what runs and drives a lot of legislation and focus. And the data in this population set isn't very good and has been overlooked quite a bit. So we're hoping to elevate that conversation and bring light to darkness.
So I want to go back to the education part, and you mentioned how the dental is it accrediting board basically said you've got to have some level of competency when you graduate from dental school now.
Right.
And you were able to get that in.
Right.
That needs to happen on the medical school side.
Absolutely.
What can we do? What can we learn from, and how it happened in the dental side? What can we do from the medical school side?
I'm glad you asked that. We are working with the President's Work Group and talking about how do we help elevate that conversation, because whenever an accreditation standard is there, you can either use a carrot or a stick. We want people to want to do this because it's the right thing to do. It's an ethical thing to do. And so we're talking about strategies in terms of highlighting things and making things more incentivized rather than make it punitive. Because if you're forced to do something, you're not going to get the best care you can. If you do it for the right reason, I think that that will just grow more relationships, and we have to build things constructively and hopefully bring people onto our side of seeing the right things, just like you have.
Sure. Well, we're all working towards the same goals for sure.
Yes, we are.
So one of the things that I like to do is ask guests to tell us 3 things in 3 minutes that you find or that you think are important for listeners to know about, that you think can move the needle towards health equity for people with intellectual and developmental disabilities. I mean, really, any words of wisdom that you can share with people.
Well, thanks for that question. I often start out with
I detected the.
I'm sort of recovering restorative dentist, and I kind of found prevention later in my career. I spent a lot of time fixing things rather than preventing things. And in our population in particular, they're taken care of very well as children, but once they become an adult, there's no care for them, so there's absolutely no prevention. So I think, number one, prevention, especially Caries risk assessment, and there are simple things to fix on that. Secondly, I would like to share experiences with our medical colleagues that they can do things in the medical office to help in that prevention cycle, and there's some new chemistries to that, and we're going to be highlighting some of that at this conference, and simple things that are actually medical billable procedures. And thirdly, I would like to say that if anything, I would just make sure that people talk about oral health and medical health for this population by asking grassroots questions and saying, does your dentist or your physician see patients with IDD? And then the follow-up question is, why not?
I think that's great. That like you said, grassroots effort. Let's get everyone who's listening out there to ask their dentist, ask their healthcare provider, do you see people with intellectual and developmental disabilities? If not, why not? Yeah, what are there barriers? Are there things that we can do? Are there resources that would help you to be able to do that better? And I'll tell you, one of the resources that you can offer is tell them to get involved with the American Academy of Developmental Medicine and Dentistry. You can find us online at AADMD.org. Lots of great information there, and I think you ought to check it out for sure. So, Dr. Wong, thank you so much for taking the time to talk with me today and for sharing your experiences and what you've done. I hope we get to talk again.
I'm sure we will.
On another episode and hear more about what's happening and maybe some of the results that have come about from the President's Committee and the other things that you're involved with. Thanks so much for what you do and what you've done.
Thank you for what you do in education. You've been here for a long time, and I really applaud you and your efforts. I continue to applaud your successes. Keep up the great work.
I really appreciate it. Thank you so much.
Thank you.